Good morning. I will explain the structure of digestive system. Digestive system, it is a complex of organs. Its main functions are mechanical and chemical treatment, section, excretion of undigested food components. Digestive canal is 8 to 10 meter long and has following sections: the oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, rectum, and anal aperture. Oral cavity is divided into two sections: the oral vestibule and actual oral cavity. The oral vestibule, it is the space between the teeth and gums in inside, lips and cheeks in outside. The oral vestibule is opened outward through oral opening. Lips, they are the fibers of mouth circular muscles. The outside of lips are covered by skin. The inside of lips are covered by mucosa. The lips at the corners of the oral aperture proceeds into each other by means of adhesions. The oral cavity is limited by hard palate in anterior part of soft and soft palate in above. The bottom of oral cavity is formed by the mouth diaphragm and is filled by tongue. The oral cavity is limited by teeth and gum in inside. Palate. The palate consists of two parts. The front part, composing 2/3 part of palate, are bony. It is a solid part. The rear part, composing 1/3 of palate, is a soft palate which consists of mucus with a fibrous base. On the right and left palate back are oral tonsils. They are the congestion of the lymphoid tissue. The amygdala's length is 13 to 25 centimeters, width 12 to 15 centimeters. The amygdalas are surrounded by thin fibrous capsule. Musculature of the soft palate. Most part of soft palate freely hanging down into the pharynx cavity, and it called the velum. The rear edge of the soft palate has a small ledge which called the tongue. There are a lot of muscles are located in near the soft palate. The first muscles rising the velums. Second, palatal pharyngeal muscles. Third, palatal tongue muscles. And fourth, tongue muscles. The aperture which communicates the oral cavity with the pharynx and called facies. Teeth. The teeth of human are replaced twice in life. The first teeth is called temporary teeth. The second teeth is called permanent teeth. The teeth are located in the alveolar outgrowth cells of the upper and lower jaws. The tissue covering the alveolar outgrowth is called the gum. The gum tissue is rich by blood vessels, but it is poorly supplied with nerves. The tooth consists of tooth crown. It is a part of the tooth which protrudes above the gum. The tooth neck, narrow part, is covered by a gum. The root tooth sits in the dental alveolus. The root of tip of tooth sits in the dental alveolus. The root tip has an aperture wherein come the vessels and nerves. The tooth cavity is filled with dental pulp. The tooth, periodontium, alveolar wall, gum form the dental organs. The tooth solid substances consist of dentin, enamel, and cement. The main tooth mass is dentin surrounding the tooth cavity. The enamel covers the outside of tooth crown. The cement covers the tooth root. Tooth crowns form the teeth rows, upper and lower. Tooth row contains 16 teeth, which locate in the form of dental arch. There are 3 types of tooth. The first one is incisors. Incisors has crown in the form of cutting chisel single root. The 4 incisors are on the each jaw. The main function of incisors is cutting food. The second types of teeth is canine. Canine has one long root. The main function of it, cracking and rending food. There are 2 canines are on the each jaw. The third types of teeth are small molars. Each small molar has one root. Tooth crown has 2 tubercles. The main function of this tooth is crushing food. There are 4 small molars are on the each jaw. Large molars. The upper large molars has 3 root. The lower large molars has 2 root. Tooth crown has 3 or more tubercles. The main function is the crushing food. There are 6 large molars are on the each jaw. Type of bite. There are 3 types of bites. Prognathia. The teeth are clothed, the upper incisors protrude above the corresponding lower incisors and partially cover them. Second, progenium, when the lower incisors are located in the front of the upper incisors. Third one is orthognathy, when the upper and lower jaw and lower incisors are jointed by points. Tongue. The tongue consists of three parts: tongue root, tongue body, and tongue tip. The tongue is covered with the epithelium and glandular membrane. There are papulas are on the surface of the tongue. There are four types of papulas. The first one is filiform papilla, completely covers the tongue root. They don't contain the taste bubbles, have an elongated shape. The foliaceous papilla are located on the sides on and in the back of the tongue. They contain the taste bulbs. The fungiform papillas are located in the medium part of the tongue and at the tip of the tongue. They, similar to the red point, contain the taste bulb. The shoot-form papilla are the largest papilla. Their wall contains the largest number of the taste bubble. They are located on the tongue body and back part. Functions of the tongue. First, protective function. It provides impermeability for bacteria. The second, plastic function. It provides a rapid recovery of the epithelium. Third, sensitive function. It provides a perception of pain, heat, and taste. And four, absorptive function. Glands of the oral cavity. Then there are numerous small glands and excretory ducts are located in the surface of the inner surface of the oral cavity. There are three pairs of large salivary glands are opening into the oral cavity. The first one is a pair of carotid glands. Second one is a submandibular salivary gland, and third one is the oil gland. The gland by nature of secret can be serous, mucus, and mixed. The parotid glands are the largest of the salivary glands of serous types. They are located below the auricle. They have a lobe structure, is covered with the fascia. They have the duct from 5 to 6 centimeters long and are opening near the second large molar on the upper jaw. The submandibular salivary gland belong to the alveolar tubular type, have a lobe structure, and the sublingual or oil gland belong to mucus type, are alveolar tubular, are located at the bottom of the oral cavity between the tongue and the inner surface of the lower jaw. They are opened into the mouth cavity. The main duct is opening next to the submandibular glands by one common duct. The pharynx. Pharynx, it is a funnel-shaped channel from 12 to 14 centimeters long. The pharynx begins at the base of the skull and ends at the level of 6 to 7 vertebrae. The pharynx consists of three parts: the upper part, medium part, and the lower part. The upper part is nasopharynx, medium part is stomatopharynx, and, and the lower part is laryngopharynx. The pharynx is separated from the spine by layer of connective tissue. Therefore, the pharynx is mobile. Nasopharynx is connected with the oral cavity in the middle ear by means of eustachian tubes. Stomatopharynx is separate from oral cavity by soft palate, back of the tongue, and palatal arches. The soft palate freely hanging down into the cavity of the pharynx. It is rise on swallowing and pronouncing of sounds and protect airways. Laryngopharynx begins at the level of the cervical vertebra 4 and 5 and move up into the esophagus. In the pharynx, the accumulation of the lymphoid tissue forms pharyngeal tonsils, palatal tonsils, tongue, amygdalas. Pharyngeal wall consists of 3 layers. Mucosal, muscular, and serous. The mucosa of the nasopharynx is covered with the ciliated epithelium, and the mucosa of the stomatopharynx and the laryngopharynx are covered by stratified squamous epithelium. The pharynx is connected to the bone by means of muscles. Palate pharyngeal muscle. Pharynx functions: breathing, swallowing, speech formation, and protective function. The next part of digestive system is esophagus. Esophagus, it is a long, narrow, mobile tube. The esophagus begins at the second cervical vertebra and ends at the level of 11th thoracic vertebra. The length of esophagus is 23 to 25 centimeters. The esophagus is divided 3 parts: cervical part, thoracic part, and abdominal part. The esophagus has 5 narrowing. The first one is a pharyngeal narrowing, second one is a diaphragmatic narrowing, third one is a bronchial narrowing, fourth one is aortic narrowing, and fifth one is gastric narrowing. Esophagus has 2 sphincters at the entrance to the esophagus and at the exit from the esophagus. The wall of the esophagus is multi-layer. The outer layer is formed by loose connective tissue. The muscular layer is formed by stratified smooth muscle. Next, submucosal layer and mucosal layer is covered by stratified squamous epithelium. The main function of esophagus is motor evacuation function, secretory function, and protective and barrier function. The next part of the digestive system is stomach. Stomach, it is a circular dilation of digestive canal. Stomach consists of cardial part, stomach bottom, stomach, body, pyloric part, greater curvature, and lesser curvature. Volume of stomach depends on dietary habits. Volume of stomach may fluctuate from 1 to some liters. The stomach of newborn kids is 5 centimeters. Stomach wall consists of 4 shells. The first one is mucosal shell. It is the inner shell. Second one is a submucosal shell. Third one is a muscle shell. And fourth one is a serous shell. There are 3 types of glands are in the mucosal shell: the cardiac glands, gastric glands, and pyloric glands. Every gland may be main gland and a parietal gland. If the gland excretes the pepsinogen, this gland named main gland. If the gland excretes a hypochlorous acid, this gland is called gastric gland. There are a lot of roundish elevations in the mucosal shell. Its name gastric field. Into the gastric field located gastric pits. In the bottom of gastric pits, open the gland's duct. The mucosal shell has creases. The cervical crease separates acid environment of stomach and alkaline environment of intestine. There are a lot of single-leaf follicles are in the mucosal shell. The mucosal shell is covered by cylindrical epithelium, muscle of the stomachs. The wall of stomach consists of 3 layers. The outer layer is longitudinal. Medium layer is circular. And inner layer is oblique. There are gatekeeper sphincter and gatekeeper flat between stomach and intestine. Inside stomach covered by serous layer. The serous layer is part of peritoneum. Stomach has acidic environment of pH. There are 3 shapes of stomach: in the shape of horn, in the shape of hook, and in the shape of a stocking. The main function of the stomach: accumulation of food, digestion of solid food in the liquid mixture.